AstraZeneca says its COVID vaccine is 79% effective in battling COVID-19.
Yeah, the company also says they have not identified any safety concerns, even though that was discussed over the last month or so, related to their vaccine. So far, AstraZeneca's COVID vaccine has not been approved here in the United States. That's coming, though, fairly soon, I would think. Dr. Oz joins us now. Hi, Dr. Oz.
Good morning, Mike. You're right. They're going to be applying for emergency use authorization. And let me just explain to the audience when you were hinting at the negative press that AstraZeneca got. There was an argument that blood clots were more common in people who were getting that vaccine. However, that was ruled not to be the case, as far as anyone can tell, in the European trials. In the U.S. trials, these were not an issue. 79%, as you mentioned, is the benefit in reducing the chance of getting ill, but the chance of getting really sick was about 0. So like all the other vaccines, the other 3 vaccines we have, there's almost no chance you'll end up in an ICU and an intubated situation or die if you've been appropriately vaccinated. So I do think it'll eventually get approved as well.
Yeah.
Is it 2 shots as well, Dr. Oz?
Yes.
Okay.
And one of the reasons that we want these extra vaccines, because we have enough probably for most of us by May or June, if the other 3 we already have, is that we need vaccines for the rest of the planet. And so we want more of these vaccines coming out as much as possible. If they're less expensive, especially, and this one might be. And there's lots of doses of this vaccine, so it can be distributed around the world pretty rapidly.
I wanted to talk to you about this. The Texas Roadhouse, the man who invented the Texas Roadhouse, there's like 500 of them around the world. He caught COVID-19, but as a result, it sped up or exacerbated a condition of of his inner ear. He was the ringing in his ear. What did they call that?
Tinnitus. So this gentleman had long hauler syndrome, and we've talked about that on the show quite a bit, because it turns out that a good percentage of people who have COVID-19 are going to survive and do fine long term, but they suffer for weeks with lethargy and it's just not brain fog, just not being themselves. One of the complications, besides losing your smell, is you actually start to have hearing issues with ringing in your ears, probably from the inflammation caused by the virus. Some of these folks with long hauler syndrome just don't get better. I mean, they're suffering months and months later, and that's what apparently was going on with this gentleman, so much so that he took his life. I'm also concerned that in some cases, the virus actually changes how you process information, how your brain works, enough that you become suicidal. We covered this early on with the ER doctor at my hospital, New York Presbyterian, who took her life. She'd never had a mental health issue.
Yeah.
She got really sick with COVID and just had trouble dealing with it. And her father was a doctor, believes the virus was responsible.
Yeah.
And you hear stories like this, and it just reminds you of how serious this can be. But then you see what's happening in Miami, where there's been plenty of videos of folks just having a good old time.
Well, young people are frustrated. They believe that they've been shut down for a year. They want to do what we all did when we were their age, go to Florida and party it up. I remember, I was at med school at Penn, and we'd go down to Florida, just what these guys are doing, and we'd have a great time just to, recover from the winter. So I understand young people. We're a month away, from having all the people who are older and at risk in this country vaccinated, if they want to get vaccinated. So we're not far from the finish line. And I'm worried, I'm already hearing stories about these kids, when they get together, they spread the virus rapidly amongst each other. They don't get that sick, but they can spread it to their own family. So my plea is, at least don't go home to grandma. Stay in your dorm room when you go home, so you limit the infection spread that occurs, that people can deal with it.
Hey, did you already tape your Jeopardy hosting gig?
I just finished, yes. I taped 2 weeks. It started tonight, as you know. Alex Trebek was a very close friend. I have increased respect for what he could do. Because it's like drinking from a fire hose to host that show.
Yeah. Oh, my gosh. So the first one we can watch tonight.
It's on tonight for the next couple of weeks.
Okay. We're excited to see you.
I'll have to tape it because I'll be watching Fox
Thank you very
29.
much.
Dr. Oz, congratulations. I was thinking about that.
Take care, my friends.
I never would, not that they're going to ever ask me to host Jeopardy. I would say no. It's too hard.